It's Dr. David Kemp here to talk a little about vertigo. Okay. Now, the two most common diagnosed vertiginous conditions are Meniere's and BPPV, which is benign paroxysmal positional vertigo. Now, the reason they're the most commonly diagnosed is because they're the most studied. Okay. Now, for Meniere's, you have to have tinnitus, which is ringing in the ear. You have to have deafness or early loss of hearing, and you have to have vertigo or dizziness. So all three of those have to be there to be diagnosed with Meniere's. So if you have all three and that's your diagnosis, then right, that's good. But if you don't and that's your diagnosis, then it's probably a misdiagnosis. Now, benign paroxysmal vertigo. This is very common. You got these little canals in your inner ear, and you get fluid in that canal and some crystals that can break loose and give you a vertiginous episode like the world is moving. Now, if the world is moving, that's better than if you're moving, because that means your brain's perceiving your world, which these are a little easier to treat. These little canal repositioning exercises really work. So after a week or so of doing that, you should be better, then that's the proper diagnosis. Now, as far as medication, the medications given for these disorders are meclizine and antivert. Now, they help with the nausea of the disorder, but they don't really get rid of your vertigo. So there's really no drug for vertigo. Okay, you're just going to have to get over it or suffer. Okay, now if you have those symptoms and that is not your diagnosis, or you have that diagnosis and different symptoms, then you're going to want to stay tuned to a follow-up video on other disorders like labyrinthitis, neuronitis, otolithitis, right? And there's a number of other things that can cause vertigo. So if that's the case, then we're going to discuss a little bit about anatomy and other vertiginous conditions if you stay tuned in the next video, okay?